radiologist has to go to medical school for 4 years. We have to do an internship and we have to do a 4-year residency. Then a majority of radiologists then do a fellowship, which will vary in size from 1 year to 3 years. That is multiple years of training, multiple years of debt. Mm-hmm. So our experience is vastly different than a nurse practitioner and a PA. Again, I'm not discounting the role. I have a tremendous amount of respect for the nursing field in general, particularly after what we've dealt with COVID. These are essential members of the workforce in healthcare. However, it is very important for physicians to be able to distinguish ourselves from an NP and a PA. And another thing we should discuss is there's nomenclature changes, coming, where, for example, in the state of Colorado, PAs, physician's assistants, are called physician's associates. In other states, nurse anesthetists are going to be called doctors of nurse and anesthesia. Like, these changes can be very confusing to our patients. And this is why I tell my residents and I tell my trainees that we should avoid using the term provider. We are not providers, we're doctors. I think it's important that we use appropriate nomenclature to distinguish ourselves. A provider is a generic term. I respect the term provider. That is a term that we use often in my facility, but we're doctors. Mm-hmm. And I think it's important to make those distinctions.
Yes.
Certainly.
Do you think that the change in the nomenclature is intentionally trying to confuse the public?
I think that we have to be careful. I don't think anybody's trying to mislead, but I do think that it allows interpretation. It expands interpretation. And mm-hmm. I think, for example, if your average patient is not educated as to the different roles of providers versus physicians, they may be confused. Again, I'm not discounting the role of PAs and NPs, but I think there has to be a distinction. And I don't want to use the word confusing, but I think that's the slippery slope it could go down, to be honest.